So to begin with, as probably anyone who's been in pain for any length of time already knows, there are lots of ways, lots of different lenses through which you can look at pain. You can look at pain through your body as a sign of physical injury. You can look at pain through the lens of your mind as a manifestation of negative thoughts and feelings. You can look at pain through the brain, which is I'll be talking a little bit about tonight. Again, one of the big new developments in pain management. You can look at pain through the lens of trauma, which is another way of understanding pain. Each way has its validity, and each way adds a little bit more of a piece to the puzzle. No one piece has all the truth, but I think the trauma pain connection is a very useful lens to understand. It's not one that many people know much about, and explains an awful lot about chronic pain, why people have it, and what they can do about it. And okay, so in this approach, I'm going to show you how to use different brain capabilities to manage pain. So there's two things we're looking at tonight: trauma and the brain. So what are the main things that the brain does that I'm going to show you how to use? Attention, memory, imagination, sensory processing, and new learning. So we're really going to approach the problem of chronic pain from a trauma and brain informed path. And you'll see that this enables you to change your brain, change your pain in the most efficient way. First of all, what is trauma? Well, most of us would understand trauma as something that happens to soldiers or people who have been through very kind of life-threatening events. But in actual fact, as we've learned more about trauma, we've discovered that people who had a lot of stress in their childhood, perhaps whether it was domestic violence or a parent with a mental health, actually show up with very similar levels of anxiety and trauma to people who have been through combat situations. And we call these childhood antecedents of trauma adverse childhood experiences. And an adverse childhood experience can be physical abuse, but it can also be conflict or domestic violence in the home, or just parents not being present to their children because they're distracted by other things. So one of the definitions of abuse that not many people are aware of is using a child to satisfy the emotional needs of a parent. So I want you not to make waves. I want you to be a doctor. These kind of messages that children get are actually a form of abuse that subvert their emotional development and lead to stress that predisposes people to illness and injury. So there are three main types of adverse childhood experiences. One is abuse, physical or emotional or sexual, which most people will be fairly familiar with. Another one is neglect that I was talking about, which can be physical, but is often emotional. And the third one is just household dysfunction. If there's a relative in jail, or there's divorce, or there's domestic violence, or a parent with a mental illness, all these things can create enormous stress in a child, which shows up in adult life, a phenomenon we psychologists refer to as the body remembers. And so how does this affect you? How does it affect an adult survivor of childhood adversity? Well, they may or may not have a condition that's known as post-traumatic stress disorder. And the three main symptoms of that are that you feel stressed, tired, and scared. And this is how a lot of chronic pain sufferers really feel. They're never able to relax. They're in a state of constant tension. Their fight-flight response is always going. When's that next pain flare-up going to happen? They're tired because they're just not getting any sleep because of the intrusion of pain on their sleep. And they're anxious. They're worried about how they're going to cope, what's going to happen, their future, their ability to work, etc., etc. And in a person with PTSD, these symptoms are added to with avoidance. People just don't feel safe to face any sort of challenges or stressful situations in life. They have mood regulation problems. Their mood is up and down. They're irritable. They may feel dissociated or disconnected or numb, just unable to smell the roses, depressed, guilty, shameful, and just bad about themselves. So post-traumatic stress disorder isn't something that's restricted to combat veterans or victims of sexual abuse or rape. The symptoms of it can show up in lots of ways and lots of people.
Mark, I'm struck by that list and how, if you look at that list, it very much sounds like the experience of chronic pain, doesn't it?
Yes. Yes.
Exactly. But yeah, interesting. Thank you.
Exactly. Whereas I don't think most chronic pain sufferers would identify themselves as PTSD sufferers.
Right. Right. Yeah.
But as you're about to see, there's a huge overlap between the two conditions. So post-traumatic stress disorder normally affects between 5 and 10% of, shall we say, people at the normal population. It's a significant percentage. But in chronic pain sufferers, the rates of post-traumatic stress disorder range from 20 to 50%. So it's very common in chronic pain sufferers, affecting as much as 1 in 2. And even if you don't have that diagnosis, as you saw from that previous slide, chronic pain sufferers will have a lot of symptoms of post-traumatic stress disorder. And regardless of whatever else has happened to you in your life, chronic pain is traumatic. If it's not directly life-threatening, it certainly takes away your control, your sense of well-being, your ability to feel safe in the world, and over a long period of time. And of course, if you have had a diagnosis of PTSD, then you're even more likely to have chronic pain. So again, that huge overlap between the two conditions. The other thing I just want to mention is attachment. And remember, we talked about adverse childhood experiences. So I just want to mention attachment because this is a concept that perhaps lay people aren't familiar with. But in psychology, attachment refers to the relationship that a child has with its parents. And it's really where we learn about ourselves and how to regulate our emotions. And if there are problems in our attachment, if our parents are abusive or neglectful or disturbed, then we learn that the world's not a safe place, that there's no one that we can turn to feel safe, to get our needs met. And that causes stress in children, and which they retain as they grow up. And they have to learn to meet their needs in kind of maladaptive ways through addictive kind of behaviors or habits, or workaholism, pleasing others, all things which are not good for your health and which really put a lot of stress and strain on your nervous system. So this is another factor that's very common in chronic pain sufferers. 75% of chronic pain sufferers have insecure attachment. So that's even more than PTSD.